disorder is a developmental disorder that affects communication and behavior. Autism can be diagnosed at any age, and as a rule, it causes difficulty with communication and interaction with other people, restricted interests and repetitive behaviors, and sometimes the symptoms hurt the person's ability to function properly at school, work, and other areas of life. And because April is Autism Awareness Month, we're going to shine a little extra light on the topic. Plus, we're going to offer up some different treatment options out there here in our community. Bruce Moseley, Executive Director, and Regan Hall, Director of Therapy Services over at Turn Center, are here with us today to talk about autism spectrum disorder. First of all, this is a very, very fascinating topic. There are so many people impacted right here in our area, and I think as a community it is important that we understand it more so we can be of better service to those with autism. Yeah?
Absolutely.
Okay, so let's talk about the prevalence. I mean, the number 1 in 68, right? We know that. But when you add it all together, there are a lot of people in our area that are impacted.
Yeah, 1 in 68 is the 2010 Center for Disease Control number for the prevalence of those diagnosed with autism spectrum disorder, and which comes out to about 1.5% of the population. And when you apply that to Amarillo and our population of 200,000, that's roughly 3,000 people who have autism spectrum disorder in Amarillo, Texas alone. And so it is an issue that our community is dealing with.
So let's talk about how it's diagnosed, maybe ways that it presents itself in people.
So you can recognize symptoms in a kid as young as 18 months or younger. There might be limited eye contact. Their language skills might be delayed. They may want to go off and play with themselves and not be with a group of kids or family. So at that age, parents can seek out, they usually start with their pediatrician.
Right.
And then they're going to get referred out to a neurodevelopmental specialist, which is usually a licensed psychologist. That can bring them in for testing and do an official assessment.
But the thing about autism, I think, and that's what's so interesting about it, is it does show itself in so many different ways, and that's why it's called a spectrum disorder, because not one case is exactly like another case. Do you find that?
Yes, that's correct. There is no cookie cutter case. You know, each and every one of us are made very, very unique by our Creator, and so the symptoms can vary. They can be more extreme, you know, somebody that's nonverbal to someone that's very high functioning and can carry on a very good conversation with a person. So the way we would treat those kids is we treat the kid, not the diagnosis, you know, because we want them to be able to function in society just like everybody else does.
And an autism diagnosis means, though, if you catch it early and you start going through therapy and treatment, this is something you can function with your entire life, and you can function well, right?
Yes, absolutely. That is a therapist's goal, whether it's speech, occupational, or physical therapy, is to make these kids independent and function out in the community, at school, at home. So we are providing the family and the kid with tools and strategies that they can use from the time they're little well into adulthood. So it's a very collaborative approach. We want the parents to be involved, and we want to know what their concerns are. What do they want their kid to be good at and better at? What can we work on?
Absolutely. So let's talk about therapy resources. There is a scarcity of resources here. I would say probably everywhere, but particularly here it does feel a little bit tough.
It is, and especially with, I would say, the diagnosing of autism is an issue. We know of a lot of children who need to have a full psychological evaluation to determine whether they have autism or not. And there aren't a lot of places to refer them to in Amarillo or Lubbock even. Most of our resources in Lubbock now don't accept Medicaid because of the Medicaid cuts in the last legislative session. And so we're really struggling right now to partner with outside experts to come to Amarillo for right now, which is honestly just scratching the surface. And then once they have the diagnosis, of course, there's a limited number of places to send these children to for therapy. And so we're lucky to have a few, and we're lucky to have the good hospital systems that we have here in Amarillo, but there's definitely not enough resources right now to first diagose and then to second to treat.
So what
these
can we
children.
do? I mean, I know there are parents out there that are struggling with that, you know, on a very micro level, but in a macro sense, what can we as community members do?
A great question, and a big problem, I think, in a lot of healthcare. With a lot of healthcare issues, we have trouble getting pediatric specialists to Amarillo, and I think that's been an issue for a long time.
Yeah.
Texas Tech and Children's Miracle Network have been doing a really good job of recruiting pediatric specialists to Amarillo, so we don't have to send as many of our kids to Scottish Rite in Dallas or Cooks in Fort Worth, which is where most of our children have to go for their surgeries or for some of their assessments right now. But so as community members, I don't know what the answer is now for long-term recruiting of specialists,
right.
But for most rural places in America, this has been an issue for decades.
I guess awareness is the #1 thing we can all do. Be
Absolutely.
more aware, be more understanding of the problem, and be more understanding of the kids and the adults with the diagnosis, right?
Absolutely, and something you mentioned about the early intervention is that we do know the earlier we can catch them and provide them the therapies that are evidence-based best practices, the better off these children are. And it's gotten earlier and earlier. 10 years ago it was 5 years when we diagnosed autism.
Right.
Then a few years ago it was 3 years, and now the leading research out of Florida State University is that 18 months with some of the more severe cases, like Regan mentioned, when they're nonverbal, or the ones that we're catching the earliest as infants are the ones who really don't like to be touched, arch their backs when they're trying to be held by their moms is a telltale sign. And then, of course, once we have a lot of these children in our community now and who are receiving therapy services, but oftentimes life's a struggle for them.
So talk about you brought a few books in to help kind of the layman out there understand a little bit more about
Yeah, so one book, this isn't necessarily for laymen, but this, you really touched on at the beginning. I thought you did a good job of describing what the diagnosis of autism is. And so that's just where all psychologists, neurologists, when they're diagnosing anyone with any kind of mental disorder, which is what this DSM-5 is. So this defines autism, and like you said, it really comes down to a communication disorder. So if viewers are wanting to learn more, the book that's made the most impact on me, and I've read dozens of books on autism, is this The Reason I Jump, and it's written by a 13-year-old boy with autism from Japan, and he writes the book after years of therapy by pointing to one letter at a time, is how he wrote this book. Cool. The premise, I think, without ruining it for everyone to read it, is that they want social interactions.
Right. They just don't know how to do it.
They don't know. They just don't know how. And then the other one is by Temple Grandin, who's probably the most famous person with autism. She has a PhD. She's a professor at Colorado State, and she's designed all of the cattle feedlots in America because she can feel what the cows are feeling. And so she's this really successful advocate for people with autism, and her book is really well written. I think this is her latest. She's written several, but I thought this was really accessible the way she wrote it.
Wonderful.
And it's really for everyone to read.
Very good stuff. Oh my gosh, I could talk to you guys for forever. Thank you so much for being here today.
Thank
we really appreciate it. And we're going to talk with you guys and more representatives from Turn Center in the coming days and weeks about autism and how we can better treat this disorder and help our kiddos out there with it. So thank you guys, and for the important work that you do. We appreciate you. Okay, stick around, everybody. We've got more after the break.